So most upper cervical chiropractors stop at C1. The atlas is adjusted, patient goes home, everything else will sort itself out. That works sometimes, but it doesn't work for every patient. And there's a structural reason why that's happening. Today I want to let you know how we do it here at Koru, how we handle the spine below C1 or the atlas bone, and how we use this technique called the Pierce Results System, what it tests, what it corrects. This complex has many downstream effects throughout the entire spine and the nervous system. There's postural compensations, there's altered blood and CSF or cerebral spinal fluid flow, dural tension. We've covered all of that in prior videos, so if you want the full breakdown, check those out. But here's the honest clinical picture. Getting someone's atlas corrected doesn't always solve all the problems below that. Now, most NUCA doctors are not going to want me to say that, because for them, or if you are a purist in NUCA or other upper cervical approaches, that's like the one thing, right? If you get this corrected, if you get the ultimate correction, everything's going to balance itself out. And I see that in my practice every day. But here, even just as myself, as an athlete, I can be in alignment in my upper neck, have a great correction, be holding it for a long period of time, posture's perfect, balance is perfect, my head and shoulders are level, and yet, sometimes I get a little pinch in my SI joint. And when I get my sacrum adjusted, it feels great and it goes away. So who am I as a chiropractor? I want to be focused on correction, but I'm not above adjusting below C1. Okay, so that's something that just philosophically is different in my practice. Now, on the flip side of the coin, if I go and talk to a bunch of Pierce doctors, they're like, dude, why are you making such a big deal of atlas? It's not the only bone in the spine. It's not the one that is stuck or it's moving fine or whatever their conversation point is. And the reality is, hey, this is the most complicated area in the spine. It takes a lot more than a drop table adjusted to correct it. And so we need to be even more specific and even more analytical and even more gentle at the top of the spine. But again, doesn't mean there's not problems below C1. Now, that's my professional opinion. That's why I don't fit perfectly into any camp when it comes to chiropractic care. I'm always kind of the black sheep, and that's all right. If I wasn't good with being a black sheep, I wouldn't be a good chiropractor. All right. Getting back to the spine. Imagine you had this big upper neck misalignment. You've had all this twist and compensation for decades, right? Maybe you've acquired some misalignments elsewhere in your spine. And we can get the head and neck on straight and just kind of let the rest work itself out. Or if I see a direct problem, if I have the test results that show me that you could benefit from a structurally focused correction somewhere else in your spine, like for example, your upper back or your pelvis, then I'm not opposed to doing that, okay? Now, I'm not just gonna do like a traditional adjustment and say, hey, lay down on your side, let me just like wring you like a wet towel and crack your spine from head to toe. No, that'd be completely counterintuitive and counterproductive to really what we're trying to accomplish at the top of the spine with NUCA. And so that's why I specialized and certified in the Pierce Results System. In fact, this was actually the first chiropractic technique that I really fell in love with because they have the same principles as NUCA. They do before and after imaging with adjustments, so I can actually see how an area of your spine is being realigned, how it's structurally better alignment, how it's actually maybe functionally moving better. And that's what the Pierce Results System is all about. We also use advanced neurological testing. So I use thermal scans every time you come into the office so we can see exactly where your problem spots. And we're able to use a low force, high velocity. So it definitely moves a little quicker than the NUCA adjustment, which is more of a sustained contact, but it's very gentle. There's no twisting, there's no cracking, there's no popping. I can adjust 90-year-olds using the Pierce Results System, whether I use the drop table and a hand adjustment, or I use my instrument percussive tool to like tap on the spine. But either way, there's multiple ways to skin the cat. But ultimately, if you've got a problem somewhere else in your spine and we've gotten your upper neck corrected in a meaningful way, then I'm not opposed to adjusting those other areas. And again, it is just as gentle and specific as NUCA in terms of how we look at the spine, how we correct the spine. We even use vectors just like NUCA does, okay? So just like NUCA, when you come in, we evaluate your head and neck position, we evaluate your posture on the anatometer, your balance, your leg length. There's always a test and then an adjustment if needed. There's no guessing, right? Well, Pierce works the same way. We use testing to determine when we adjust you a certain way. It's not just because it's a Tuesday or because I feel like it, or even because you're complaining about a certain symptom. It's all based on the test results. We use that vector specific adjusting. And what that means is the correction is delivered along a very precise direction related to the actual structure and alignment of your spine. And so this vector is unique to you, and it is a custom tailored correction. And I always do like to reinstate, this is a low force, but it is a high velocity adjustment. So there's no twisting, cracking, or popping, but you're definitely going to feel it more, impactfully per se than the NUCA adjustment. Both are very important. Both get done in my practice on just about every single patient, but there is a difference between the two of them. Now, the Pierce Results System or the PRS system, the analysis, like what do we actually do? The first thing we do is we do standing structural x-rays of the low back and pelvis, as well as the neck, where we actually do a motion x-ray. So I'll do like a flexion extension, and I can see exactly in the neck where things are getting stuck, or in your low back, how the pelvis and sacrum are shifted, twisted, or misaligned. So from those x-rays, like I said, I can identify specific vertebral misalignments below C1, the direction and the relationship to the adjacent segments, like really how to best correct it, what direction things need to move, just like in the upper neck, and when the adjustments are indicated, and eventually we retest. So as I mentioned, it's really the same philosophy as NUCA in terms of the test, don't guess. It's just focused on more vertebra than just top bone of your spine, your atlas bone. So most upper cervical chiropractors, they're really trained on one technique, and they use that technique to really address everything. And that's not a criticism, it's just how our specialty training works, right? And so that's why most NUCA chiropractors don't really touch anything else, is they've got so much to focus on already with the upper neck that's good enough. And honestly, I'd be happy to do that myself. Most people come to me specifically wanting a treatment different than their traditional care. So I'm happy to just do NUCA. However, if I find that there's problems elsewhere in their spine, I'm going to tell a patient that, hey, let's tackle the upper neck. Let's get that corrected to the best of the ability, like you haven't had corrected anywhere else. However, I do see this problem, in your sacrum or in your upper back, that if we adjust this periodically, I think you'll get even better results. One of the things Dr. Pierce was really well known for was he started as an upper cervical chiropractor, and he was one of these first of this era of chiropractors to really look below C1. And he found that sometimes people would have outstanding injuries or multiple injuries on top of each other, and all of a sudden they wouldn't just have a C1 issue, they might have a C5 or a C6 issue, right? And then the more he started to investigate this and really focus, actually a lot of it came about on being concerned with what we call curve correction. He saw a lot of people who were getting great upper cervical corrections, but their curve still looked really straight or even reversed, and they were still complaining about some of those symptoms that we see that respond well to adjustments in other areas, right? So if I get someone adjusted in their upper neck and they go, wow, yeah, and I have more energy, my migraines are gone, my neck pain's better, but I'm still have some numbness and tingling. Well, if I saw a problem at like C5 or C6, which that's where those nerves go, then I'm going to adjust that area, okay? And the thing is, sometimes we've had so many injuries or the misalignments have been there for so long that, yeah, this can make a big change really quick, but it can take a little bit more precise work in other areas of the spine to get those other problems fixed, at least at a quicker rate, so that patients really know that they're getting better, right? They don't want to feel like only 25% got better and hey, just let it cook for a couple of years. I'm sure eventually the rest of it will get better. No, people want results. That's what we're all about, results. So the good part too is with this testing is if I don't see a problem anywhere else in the spine, maybe just at the top of the spine, then we don't correct it. Not every visit involves Pierce work, just like there's some visits that don't involve NUCA work. The vast majority of people in the practice, however, do need NUCA or an upper cervical correction, and many of those patients also can benefit from corrections lower in their spine. And the combination of these corrections, it looks really different every time a patient comes in. So sometimes people need a upper cervical correction, sometimes that's holding, but they've got a misalignment that's more obvious in their low back. Once we get a lot of these things adjusted, their hold times increase, their symptoms reduce, the results just get better and better. So it's really based on what shows up on each given visit after I've done my full neurostructural testing. And you're not going to get everything adjusted every time, but we want to make sure that if you've got that problem, as soon as we identify it, that we do get it corrected as quickly as possible. So that's really what neurostructural testing and neurostructural chiropractic, corrective care, like what we do here at Koru, is all about in this practice, right? It's not only upper cervical, it's not just full spine by routine. It's testing driven, objective, before and after imaging with a neurological focus. And it's based on each individual specific situation. And so each care plan, each adjustment is always tailored to you. So if this sounds like something you're interested in, I'd say it probably is time to sit down and do a consultation and really figure out what is going on, what approaches you've tried, what's working, what's not working, and really what we can do to help you with the Koru approach. If that sounds interesting to you, there's a link below that you can schedule a consultation. If you found this useful, make sure you watch my next video. We're going to be breaking down more on the atlas subluxation complex and really all the things that we do here at Koru Chiropractic. So if you have any questions about Pierce or upper cervical care, how the two work together, leave it in the comments. Make sure you subscribe, and don't forget, we test, we don't guess. I'm Dr. Norris Golberg here at Koru Chiropractic in Louisville, Colorado.